Welcome to the Heart Rate Variability Podcast. In this podcast, we discuss the exciting science behind HRV and how you can apply it to your own health and the work that you do. Just a note, this podcast does not replace medical advice, and if you're going to apply this to your own life or others, please consult with a medical provider. Thank you and enjoy the show.
Hello, everybody, and welcome again to another episode of the Heart Rate Variability Podcast. My name is Jeff Summers, co-founder of Optimal HRV, here with my partner in crime, co-founder Matt Bennett.
Hey, Jeff.
Matt, how are you doing?
Oh, living the COVID life, man. Living the COVID life.
Well, it's gonna be weird, man. When this episode is published, it's gonna be right after Thanksgiving, I guess.
Yeah.
So, it's gonna be a very strange holiday season.
Yes.
This year for probably all of our listeners.
A lot of uncertainty. That's been sort of the theme of these intro conversations. Hopefully, if you're listening to us in like 2025, the world's just a wonderful place.
Hopefully in 2021, that's the case. Hopefully we don't have to wait 5 years for that, right?
Hopefully.
Exactly. That's right. Well, hopefully you and Sarah had a nice holiday. And
yes. You and your family as well.
Yeah, it was much smaller than normally would have planned it to be, but that's okay.
Yeah.
With the progress of these vaccines, hopefully there'll be a lot of progress in the not too distant future.
Absolutely.
That's it. Well, hey, we've spent a lot of time dedicated to kind of going chapter by chapter, discussing major themes in the book, HRV book that you published. Man, has it been 4 months ago now?
Yeah.
Hard to believe, but we're coming to the end, and we're kind of the last chapter is really on leadership and how HRV applies to folks that are leading teams, leading organizations. It can be small, can be large. It really doesn't matter. The same concepts apply. So I think this is a very different application of HRV that not a lot of people have thought about. Right. And so I think it's very powerful, and it's something that really excites me. And I know you're in the same boat. So, maybe just kind of help people understand why, as a leader, it's important that they need to be paying attention to something like a biometric.
That's
do a better job.
The real innovation that I believe our app allows is, there's sort of an analogy that other apps have used out there that focus on athletics. So if you think about it, so let's use that and let's build that up, because, in the nonprofit world, we talk, self-care is becoming more and more of an issue because research says we are a mess. And I'd love to see like your business experience with this as well. But if you think about what is the athletic world is doing, is that, again, when we talk about HRV being a sign that you're handling or recovering from stress, that you're doing a good job. High HRV shows that your body is handling or recovering well from stress. Now, for a coach, for the most part, even though, I don't know, you hear those statistics as it's, 99% psychology, 1% physical. As a guy who had a vertical leap of a cow, I really, I never believed that. And I'm a psychology major. So I'm like, no, there's some physical things. If my vertical leap was a little higher than a cow's can jump, I think I might have gone somewhere else besides Lindsey Wilson, but love you, Blue Raiders. So you look at that, and so a coach before practice could look at, or leading up to a game, could look at the team's HRV score and know how far to push the team collectively, but also maybe an individual there needs more rest. Maybe somebody for whatever reason, maybe struggling with early symptoms of disease, like a cold, even something that simple. But maybe, just they played a lot of minutes in the last game and haven't fully recovered. Even maybe it's 2 days later and they've not fully recovered. Interesting enough, maybe, a few of them went out drinking the night before. We're in the COVID era. It's like, why are these 18 and 19-year-old kids just staying in their dorm rooms and playing football? Like, because they're 18 and 19-year-olds. So
because they're in college.
But it really gives the coach an ability to say, okay, how far can I push individuals and what should I expect from my team today in practice? And so there's this ability to really craft what you're doing that day around heart rate variability. Now, in the business world, it's a little bit different because no matter what, you could, as a coach, cancel practice. And, even some of the good coaches I had, my dad did this. He's my basketball coach, and I won't get into that because that's a whole traumatic history there. But, there'd be some days, and I think my dad would catch himself after maybe a tough loss or a tough game. It's like he put up the volleyball nets and just said, today we're playing volleyball. And he kind of like say, I'm done with y'all. You're playing volleyball today. And we were terrible at playing volleyball, but it changed the energy. We kind of needed that psychologically to recover as well. In the business world, you got to show up and do your work. And if you're in a health clinic or you're doing, running a homeless shelter, you got to show up for work. So it's a little bit different than the analogy. But as a leader, what the metric really gives you, if you look at the daily readings of the teams you supervise, really gives you a metric is how is my team, how are my folks doing today? And we talked about this in the last podcast, so much better than one of those surveys we give out every 6 months or every year, right? I'm not against those surveys. In fact, I like employee satisfaction or engagement surveys. I think they're very valuable. But they're just too big of a gap between that feedback that a leader gets. So on one hand, you can track daily is how are my folks doing? And again, it allows you then to ask questions if they're not doing good, if they're performing. And this is where that population norm really comes into play is, how's my team? If I have a team of, let's just say 30 people for a nice round number, that's enough data to say, while the individual, there might be a lot of genetic differences, 30 people, the baseline average of those 30 people gives you a really nice metric to measure them against. And so as a leader, as I enact things to improve the productivity or the health of my workforce, I should see impacts on HRV. If we're doing a wellness program, if we're, maybe doing some preventative medical stuff, if we're trying to build morale up and we go out for a retreat, we should see some improvements over time. So it just gives you the metrics of how the team is doing. And we talked a little bit last time as well, is that if you have a staff that's struggling, HRV gives you a way to really start to look at burnout and other negative consequences of work stress. So if I've got somebody burned out and nothing's going on in their personal life, because, that's going to show up as well in HRV, it gives me a chance to really sit down and strategize with the person to say, okay, how are we going to get you back up to your baseline? What is the plan to do it? And then measure that approach and really be strategic about it. One of the things I think about, we do this out in Colorado is, sometimes, we're going to take a ski vacation. Well, ski vacations can wreck your HRV. One, because you're doing really hard workouts each day if you're pushing yourself. Two, you're probably eating and drinking stuff at a different rate than you normally would. So really being strategic, okay, maybe you just...
Sure.
On a weekend, you need to just take 2 days to crash on the couch, right? Just to have that recovery. And then maybe going on long walks, being in nature, a lot of the self-care things we found. So it gives a chance to really support people from that position. And then the other thing that I'm really fascinated with, and I think this will be controversial when I say it, and I teased it in the last episode, is I really believe you've got a leader, a manager supervising 30 people. I believe that the HRV score against population norms should be a metric to measure your effectiveness as a leader. Now it's one measure. It should not in any way, shape, or form be because you could have the happiest team in the world. If they're not doing anything, not good, right? So along with productivity scores, because we know for the athletic analogy we're using, if the team is recovered, if their HRV shows everybody's in green, they're going to perform better on the field, on the court, wherever they're at. The same thing with your employees. If your collective reading's in green, there's plenty of data, and we hope to collect a lot more of it over the next few years to show that they're in their prefrontal cortex, they're emotionally regulated. In other words, they brought their best self to work today. So it's really looking at it from that perspective of, is this leader, how are their team doing? And if overall you see that this team is struggling, hopefully then the system will support the leader in strategizing about how to bring this group back up to the population norm or to outperform it. But I see this as a real potential competitive advantage for organizations that decide to implement this. In the helping professions, again, I mentioned this, but I can't say it enough. Physicians, number one, nurses, two, social service, social workers, three, teachers, and principals, 4 and 5. We're a mess
in terms of burnout.
And so we need to, and that was before COVID. And we know COVID,
right.
like, again,
made it even worse.
Yes, my bedroom is now a first grade classroom. And if you know a teacher and you're listening to this and you're listening during just tell a teacher thank you, because they're working their butts off right now to really get this. But this is terrible. We cannot let this be our reality, where people that we have in so critical positions are being devastated by the work they do. So we're losing teachers at a massive rate. We're going to have a crisis as soon as the baby boomers really start retiring in mass, which is starting to happen during COVID. We're in trouble because education, a lot of people are leaving the field. The same thing you see. I heard just something yesterday here in Colorado. Nurses are starting to leave the medical field in the same type of way. I think a social worker and social service type just, we'll take the punishment, but there's only so much we can take too, or we're going to move up to those higher positions. So, when I look at the folks that, make up the majority of people in my training, we've got to start to really see this as an emergency. And what I hope is that HRV initially can say, this is how bad we're at, because all the data shows we are a train wreck. So I would expect if I went into let's just say, a bigger hospital here, and we did HRV across that hospital, it would be horrible. It would disgust everybody to see that the healers and helpers in the hospital are performing so terribly. But we don't want to get stuck there. The goal is then say, okay, this is not acceptable. We know that this is probably what you'd get in any hospital. So don't spend a lot of time just being, oh, we're terrible. What are you going to do to start to change healthcare, change social services, change education to show, hey, we can have healthy staff doing this work. And again, then our students get better services, our patients, our clients. We're going to see this really save us money and improve our outcomes over time. So again, I don't want to go in and say, okay, hospital administrators should all be fired if their HRV is underperforming. No, because we would assume it's going to be. But then start to look at it as, what's the goal? Is it a 5% increase every quarter, right? You can really be strategic with it because it's such a quantifiable number.
Right. What's the trend? Yeah. I mean, and if you look at leadership, obviously you're responsible for the organization. You're responsible for providing the best service, product, whatever type of organization it is that you lead or team that you lead. But there's also there's the human side of it. You want your people to be happy and you want them to be motivated and you want all those things. But there's also the business side of things. And, most people don't think of biometrics as a way that as a metric to, or a way to track ROI, or return on investment.
Right.
And if you look at most organizations, especially in the helping world, one of the biggest costs is churn, is burnout, is people leaving because, they just can't handle the stress anymore. And not only does productivity suffer when your HRV is low, but we talked about it in the last episode, burnout is real, and being able to prevent that, being able to keep people happy, keep them motivated, have a quantifiable way to understand where they're at, to your point, can save you money. It can make you more money. It can, do all the things that as a manager you need to be, or leader, you need to be paying attention to. So there's
Right.
the human side of it, but there's also the business side of it, and HRV can actually give you really good feedback on both, which is very
Yeah.
cool.
Well, I'm so glad you brought up turnover because, it's, in the healthcare field, because, there's been, a lot of research backing up. It costs at least $1 million to replace a physician. It costs around 50,000 to replace a nurse. I mean, you just, and again, we've got number one, number two for the professions experiencing burnout. So, you know, just think about if we could reduce turnover by 25%, it may save a hospital tens of millions of dollars. I mean,
Absolutely.
it very quickly, something that costs you less than a dollar a day, significantly less than $1 a day, can really have a huge return on investment. So, and then from that
And then,
leadership perspective too, it's like, as you mentioned with biometrics, this is new. This is going to be innovative for folks, and it's that of how do we implement this in a way where it is not punitive for the staff.
that's right.
I mean, that's
Yep.
going to be a challenge because again, if somebody's if you look at a team of 30 people and 2 people are struggling, but everybody else is doing good, it really gives us the ability to hone in and say, okay, how can we help these 2 people? And I would imagine a lot of that might be stuff's going on in their home life. So they're
Mhm.
struggling in other ways. And again, that's not my business necessarily as a manager. And if they're coming to work and producing and not hurting morale, that there's limited, ethically, there's limited concern that I should have. And maybe genetically there's something going on there, but also
Sure.
it allows me to say, hey, is there any way I can help you out with whatever's going on?
Yeah.
Let's
More
talk
time
about your
off.
score. And if you trust me as a leader, you might disclose, I'm going through a divorce, or, I've been drinking
My
more than
mom is
usual.
sick, or
Yeah. And I know that that's more probably in the helping professions where we have maybe more robust supervision, but I want to get that person help. Yeah, I want to make sure that my clients are getting the best of that person. But I've encouraged probably at this point hundreds of people to seek their own mental health counseling. It's okay. I always like
yeah, of
to
course.
think about if your personal life is impacting your work performance, go get mental health services. If your work stress is impacting your personal life, go get mental health services. That's what we're here for.
Yeah.
And why carry on? Because to me, self-care, and I'm really working on my wordage of this, is like, yeah, one of it is to give your best as you can at work, but your work should not be impacting your life outside of it as well. So really thinking, and as leaders, I think staff are desperate, and there's research to show this, that you care about who they are outside of work and how their quality of life as well. Now, again, I think in the business world, there may be some evolution to sort of get there, but I've never had a staff balk at me when I've suggested, hey, let's look at this. And most of the organizations I work for had an employee assistance program or insurance where they could get very cheap or free mental health services, which was always a benefit. So it's like, again, it's not my job even as a trained therapist. I'm not your therapist as your supervisor. And I made that line very clear. And, I had to watch out for that because in our fields, it can go back and forth, but, get some help. Well, you got 6 free sessions with your employee assistance program. A lot of folks do. You will be amazed what a therapist can do with 6 sessions. So don't have this New York Freudian sort of mindset that you have to be in therapy like Woody Allen for 30 years and still be very screwed up. So, yeah, I mean, I just
No,
think it
that
gives
makes
us a way
sense.
to support people, and we want that prefrontal cortex in every job to be on board and ready to go. So,
Well, and that makes total sense. And if you think about your job as a leader, you're working with people who are, providing services or care for their patients or their clients. Well, you're sort of doing the same thing. You're working for the people that work for you. Your
yep,
job is to enable them to do their best and be their best. And
yeah,
ultimately that is going to make your organization great.
yep,
And so how do you do that? Obviously you give them the tools from a training standpoint, from a support standpoint, um, you know, tactically to do their jobs well,
Right.
but you have to support them as people too. You know,
Yep.
you have to make sure that they're as healthy as they can be to stay motivated, to be productive, to be happy.
Yep.
And that's what's best for them. And if that's what's best for them, that's what's best for their patients. And
Yes.
ultimately that's what's best for the entire organization. So
Right.
it doesn't make sense to talk about this in a client or, you know, caregiver client or caregiver patient standpoint without also talking about it from a leadership standpoint and how you promote what you provide to your employees as well.
Yeah. Well, and I wonder kind of how you, because I mean, I look at your job historically being in sales, and you have just in many ways as relational of a job, different, obviously, as I've ever had. Like, you know, I imagine at least that if people like you as a salesperson, they're more likely at least to listen to you.
Sure.
With that, you know, I think a lot of people like get turned off because we all think of used car salespeople and
Yep.
or regular car salespeople as, you know, when we think about, but you know,
High pressure salespeople, because I've known some good car salespeople as well.
yeah, yeah, well, absolutely, absolutely. I don't want to stereotype any different profession here, but you
That's
know,
right.
looking at that is really when we talk about return on investment. I know you close big deals, like some of the with the systems and software you sell, which I'm probably not even using the right language here, but you know the those are huge at some point, big ticket items for, you know, big companies to get. And you know, what if your HRV of your sales force is you can increase that by 10%?
Oh, of course. The efficacy
You
of the
know,
meetings going up. I mean,
right,
you know, if you get somebody's best 10% more of the time, and that leads to, you know, one call that wouldn't have gone well that does, you know, and it's not because they're not, to your point. I mean, this is what we've been talking about the whole series. It's not because they're not trying.
right,
It's just because in that moment they're not able, and
yep,
maybe they missed something that a potential client or customer says that had they picked up on would have changed the conversation in a different direction
yep,
and taken it into a more positive outcome.
yeah,
So yeah, absolutely. I mean, you look at really any job, whether it's manufacturing, whether it's sales, whether it's, I mean, just a 10, 15, 20% increase in productivity is a
yeah,
game changer. And,
yeah,
you know, a 10, 15% reduction. I mean, salespeople, there's a huge churn in salespeople and another expensive profession to replace. So if
yes,
you're a leader and you can figure out a way to not only get more from your people, but also keep your people longer on average, you know, the return on investment there is huge. And, you know,
right.
to your point, a platform like ours costs less than $1 a day per person. You know, it's something that, you know, people should really start to consider. And
Yeah.
you know, they are, you know, we're seeing it, and I think the world's waking up a little bit, and well, that's exciting.
Yeah, there's this, and we talked about this early on. It was a documentary that when we were kind of first kicking this around, and I believe it's on Netflix right now. I was looking online, Amazon. It looks like it's on there. It's called General Magic, and it was really fascinating documentary about Silicon Valley company who really in many ways invented the iPhone in the, I believe was the early, about 1990, just looking online. And it was this amazing device, but, you know, so it kind of documents this development process and just geniuses. And they, you know, the leaders of the industry evolved out of this. I think Apple acquired them and a lot, or at least a lot of their people when they developed the iPhone. It's been a while since I've seen the documentary, but the one thing that stood out to me is they had this stretch to meet a deadline where their folks were they were sleeping under their desk. They were working 20 hours, you know, a day. And there was like this, we're supposed to see this as some like heroic
Of
effort to
course.
put into this.
Yeah.
And yeah, this great, the push and to get this out. And then they got it out and it was glitchy as hell. Like,
Lots of
and,
bugs.
yeah, and my thought was this could have revolutionized, you know, if you think what if, you know, and obviously there were a lot of technological, you know, it's kind of like us. We're trying to bring HRV out way 5 years ahead of probably when it would have, if we were trying to push it into the areas we were trying to push it into. But I just I looked at that and I'm like, here's a well-funded tech startup like, what if they would have invested a little bit more money in hiring more staff? What if those staff, maybe they slept there, but they got 8 hours of sleep? What if they were tracking their HRV? Because I would have guaranteed what would have happened, even though they had a lot of excitement, because of how they were eating, how they were sleeping, how they
Sure.
were not exercising. They had
Pressure,
to be
stress.
way in the red this whole
Oh yeah.
time. Now you
Would
think
you
about
have,
all
wouldn't you
these.
have loved to get the baseline prior to that
Oh,
project starting to know what their normal levels were and then sort of see how that
exactly.
impacted them?
So at the crucial moment of this product development before the initial rollout, they were a mess. And again, I think the documentary kind of sets them up as heroes. Like, oh, I mean, they have pictures of them sleeping all over the place and, getting up and like, I mean, just downing coffee. And, they had a level of brilliance where, they could code better than, you give me 2 years of coding, in red than I would ever in green. But at the same time, it's like, could this, if you realized, hey, the team working on this is a disaster right now, could they have made some choices along the way? And maybe the answer is no, because of where their funding was or whatever. But could they have even hired another shift to do some of the work? And to have a whole lot of green folks working on this project could have changed like the history of technology with this just ingenious product that was too glitchy and not thought out enough for its time. And it just kind of gave this case study of what we celebrate in the business world is not necessarily what is going to get you that return on investment. What we celebrate in healthcare.
I was gonna say it's not just the business world, right?
Yeah, look at these.
It's
What these
medical.
look at how we train physicians.
Legal.
We run them into the ground. In fact, talking to a lot of physicians, we in some ways traumatize these folks. And it's like, oh, this is boot camp. If you can't survive this, you can't be a fit. Bullshit. No.
That makes no sense.
Tearing somebody apart psychologically and physically to be a healer makes zero sense. And I don't want one of those interns, those students, being my physician if they're in red, right? Because one thing, if you screw up a phone, yeah, you could have, technology could have advanced at a much quicker rate, but you screw up my surgery and I'm really pissed off at you, right? If I have the capability to even be pissed off at you.
That's right.
So it's like, to think about this across, arenas and some, you don't want your airplane pilot, you don't want your police officer, you don't want your physician or nurse, because those people can really life and death situations. But, the well-being of your company is in your hands every time you have a sales call. Like,
Sure.
and so it's like you start to look at this and it just like, from that leadership perspective, knowing where your folks are would allow you to make strategic decisions. Like I said, I just wonder if General Magic, if this development, if they had maybe it's even a smaller second shift where instead of 20 hours, they were only working 12 during the rollout. Could they have, put out a product that could have revolutionized everything, well before the iPhone. So, just an interesting example and a good documentary if you need something to watch over the holiday season. So.
No, I mean, I think we both know the answer is, the product would have turned out a lot better. There's no doubt, I mean, as we all know, product is the market ready and, all those external factors coming together for you. But the product itself, we can be very confident would have been much better.
It seemed like if it would have worked, again, the iPhone would have been released 10 years earlier in some ways. Like I said, you got to watch the documentary, but like that like, and just like the cost of what they did to themselves. And again, even through the documentary, nobody talks about it. Like, oh, we work, this is the best time. It's like, no, you guys were screwing up right and left. And like, nobody's like, oh, because we were working 20 to 22 hours a day, that nobody, when we don't make that connection, HRV allows us to make that connection and really quantify it. Doesn't mean you're not going to have a hard stretch. Like that would have been a tough, stressful time anyway. But boy, if you would have invested, several of the $100,000 that the people are dumping into them on a shift to a second shift, and people got to go home and get even 6 hours of sleep. you probably would have had a much better product. So it just allows us to ask these questions, and hopefully, that some of these next big rollouts. This is why I wish we were in the healthcare arena before COVID instead of launching on March 3rd or 4th, whenever it was, because I think we could have shown to people, over the summer. And I was encouraging people, you need to triage your paid time off. You need to get everybody you can on vacation. Obviously keep the ship afloat because it wasn't unstressful during the summer, but you gotta take advantage before this coming wave that we all really saw kind of hit. So again, hopefully this can give leadership a lot of insights and be a competitive advantage for those that are looking for it. It's another way to really maximize performance, decrease turnover, really focus on the things that really matter and improve results.
That's right. So leaders, if you're listening to this, if you're leading an organization, whatever type it might be, and you want to learn more about how you can use HRV to help do all the things we've talked about during the podcast, just reach out. Sales at Optimal HRV. We've got free pilots that we offer for interested potential customers. So, let us know. We've had a lot of great feedback from some of the organizations that have implemented HRV as a metric to work with their employees and their customers, clients, patients, whatever it might be. So let us know how we can help.
Please do. Check out the book too. We've talked a lot about it, but it's still, you could buy the hard copy on Amazon as a stocking stuffer. Just think about young kid waking up on the morning, they go their stocking and they get the heart rate variability book. It's every child's dream. It's the Elmo, Jeff.
There you go. It's the new elf on the shelf. You got it. All right, Matt. Well, as always, it's a pleasure.
Love it. Everybody take care, and we'll talk to you soon.
That's it. Thanks, everybody. Take care.
Thank you for joining us for this episode. If you're interested in more information about HRV, please visit us at optimalhrv.com. Also, if you visit optimalhrv.com, you'll be able to sign up for our email list and download our free ebook, Healing with HRV. Thank you for joining us, and we'll see you next episode.